Idaho leads the nation in vaccine exemptions. This comes by KTVB7 by Hector Mendoza. A new report from the Center of Disease Control and Prevention, the CDC, which we are all familiar with that acronym, reveals that an increasing number of parents in Idaho are choosing not to vaccinate their children. The report released on November 10th shows that Idaho leads the nation with a 12.1% exemption rate, significantly higher than next closest states, Oregon and Utah, which have rates of 8.2% and 8.1% respectively. This comes as Idaho is one of only 10 states in the U.S. with an exemption rate exceeding 5%. Dr. Michael Wheaton, a pediatrician at St. Alphonsus Regional Medical Center, highlighted the real-world implications of this trend, citing a recent measles outbreak in Idaho. Quote, just this year, measles came back to the state of Idaho from an individual who went to another country where there was an outbreak. Dr. Wheaton said he was not vaccinated and he came back and we had 10 cases of measles, end quote. The CDC report indicates that exemption rates remained within the recommended 5% before the pandemic, but those numbers began to increase during and after the pandemic. While the report does not delve into the reasons for this increase, Dr. Wheaton suggests that this reflects a growing skepticism about medicine in general that was only exacerbated by the pandemic. Despite these challenges, some are making efforts to improve vaccination rates in Idaho. Quote, the state of Idaho is very unique because of our immunization rates. We've opened that program up to all children so that there are really no vaccine costs, said Dr. Wheaton. However, he also pointed out that one of the issues is that the ease with which parents in Idaho can obtain an exemption, not only for medical or religious reasons, but also for philosophical ones. Which, putting the spotlight on you, John, where do you stand on vaccinations?
In general, or the COVID vaccine?
Well, I'm pretty sure I know where you stand on the COVID vaccine, but we'll go with in general for this example.
So in general, I think vaccines can be a good idea when they do what they're designed to do. And we can see evidence of that kind of throughout history. Now, you also look at general trends, and vaccines seem to always be introduced as the general trend for what the vaccine is trying to help eradicate is on its way down. So is it the vaccine that solves the problem, or is the problem solving itself because the human body is amazing? I don't know. It's really hard to say. Now, having said that, there are some vaccines that do make sense. Getting a bunch of shots when you go to countries that have issues with some diseases, that works. It makes sense. So I'm not against vaccines in general as a blanket statement. I'm not anti-vaxxer. Having said that, I think that blindly accepting the whole gamut of vaccines just because that's what we're supposed to do, I think that is being naive and silly and not looking at all the data available. So I think that Idaho being a place where you can get an exemption easily is a good thing. Like I realize herd immunity, like the one argument that I will cede against immunizing the entire population is for those people that can't get immunized because of their weak immune systems. Okay, we don't want those kids to get sick. Granted, I agree with that. But now you have to start looking at percentages of vaccine-related injuries and then people that aren't able to get vaccines and then get sick and die from, or get sick and not even die, but get sick and then have problems because of that sickness that could have not happened because the whole population was immunized. So at that point, it starts being a numbers game. What's the worst outcome? And it seems to me that the worst outcome is demanding that someone inject something in their body because reasons. That seems to be a bad way to go.
Yeah. Usually in general, that's a pretty good rule of thumb. I would argue that the point which all this pivots on is the nature of the disease in question. So if it's a disease, like for instance, if you have a disease where 95, 80% of the population can get that disease naturally and build natural immunity, which I don't know any doctor. I've never read anything that tells me that natural immunity is worse than a vaccine immunity. Usually getting the disease itself and your body actually experiencing the real deal builds a way better immunity to that type of disease. And so if you're saying that a certain disease, you're like, yeah, for like 80, 90% of the population, they can get this thing. It's going to suck, but they'll have way better immunity than if we give them a shot and you don't have all the health risks that come with a human-made thing. Then I'd be like, well, then don't vaccinate everyone. Leave that vaccine for that extra maybe 10% that are like, yeah, I can't get this at its full strength. I need it at a weaker strength. Well, then cool. Then if you have another disease that's like, all right, this actually, there's only like 10 to 20% of the population that can get this disease and actually live from it or not have problems from it. Well, I'm like, well, now you got maybe a little bit of a stronger argument for more vaccines, more people having to take a vaccine because they can build that immunity. So if they do run into it, they won't, then that 20% of people that couldn't handle it hopefully jumps up with that vaccine. Any case, we would love, I know for me, I think this is a awesome thing to see the 12.1% exemption rate here in Idaho, that Idaho allows for that the state here in Idaho isn't cracking down and saying, well, yeah, you can do that, but we're going to try to stop you at every turn legally to do it. I'm glad to see that there is that number, that there are people and that freedom is allowed and people are exercising it. As for the implications of what that is, I think that's on a case-by-case basis, but we would love to hear your thoughts on this. If you have differing opinions or similar opinions, love to hear it on Twitter or by email. But we'll move on to the next story here and not get too bogged down on this one.